Morning and welcome to the Windsor-Essex County Health Unit's media briefing on Monday, November the 1st. This morning we are going to move right into our media questions. We have Nicole Dupuy, our CEO, and Dr. Nasathuri with us today. We will start with any questions from AM 800.
Nicole, I'm going to ask this, but I'm not sure if you'll have this information since it is Monday morning, but do you know how enforcement went over the weekend with Halloween?
Yeah, thanks for the question. I should have anticipated it, but no, I don't have a sense of how enforcement went, although not hearing anything from the team means it probably went well. But we could give you a little bit of a better flavor or an update at our next event, Rob. But I just usually if I don't hear anything, that means that things went smoothly.
Perfect. That's it for now for me.
All right. Any questions from CTV?
Yes, good morning. What are your thoughts on the PCR test requirement to return to Canada from travel?
Well, I think that, and maybe Nicole can supplement this, the Public Health Service, we don't manage the border, and the border is managed by the federal authorities. So what I would recommend to all residents is to follow the guidance of the federal authorities who have to weigh the risks and the benefits and the appropriateness of different policies as it relates to the border.
Okay, thank you. And at the end of last week, the first doses for vaccinations were barely rising, or seemed to be kind of stuck for a few days. Are there any concerns there?
Just around the rate of the number of first doses that we're seeing. I don't think we've seen a continual, we continue to see first doses. So I guess not seeing any at all might be concerning given the number of individuals that we know are still have not received at least a first dose of a COVID-19 vaccination. So I don't know that it's any additional sort of cause for concern. What we have seen in the past few weeks, we have continued to see a steady amount of first doses. So in my opinion, that is promising that we're still seeing individuals coming out and getting their first dose. We have seen also in our mobile clinics, we continue to see a fairly good uptake of first doses at mobile clinics as well, compared to those that are coming for a second dose. I don't know, Dr. Nasathuri, if you want to add anything to that.
Sure. So from my vantage point, there are still opportunities to increase the number of people vaccinated in Windsor-Essex. There are tens of thousands of people who are eligible for vaccine who have yet to be vaccinated. And we know that the adverse consequences of COVID-19 are disproportionately on those who are currently unvaccinated. In fact, the vast majority of people who are hospitalized right now are the unvaccinated. So to the extent that people have an opportunity to get vaccinated, we would encourage the vaccine. Secondly, we noted in the op-ed, we wrote a column this weekend in the Windsor Star, and we highlighted and tried to address the issues related to why some people might be reluctant to get vaccinated. Vaccines, the evidence is pretty clear. Vaccines are safe, they're effective. The side effect profile suggests that there are very few people with serious side effects related to the vaccine. And we know that if you get vaccinated, you're less likely to get sick from COVID. You're less likely to transmit COVID to other people. You're less likely to be admitted to the hospital, and you're less likely to die. So we appeal, and the health unit appeals to all residents of Windsor and Essex. If you're eligible for the vaccine, please get vaccinated. Can't get vaccinated for yourself, get vaccinated for your family, your children, your husband, your wife, for someone you love.
Okay, thank you. Moving now to COVID in schools. The number of school outbreaks dropped quite a bit last week from 9 to 2. Is the situation improving in local schools and with cases with school-age children?
Do you want to start, Doctor?
Sure. So whenever you look at data from an epidemiological point of view, it's always worth thinking of looking at data in the overall context. No one data element gives you a full picture of the current situation. We always, at the health district, we always welcome a lower number of cases, lower number of outbreaks. So those are all good things. One thing to consider, though, is that we've had more school dismissals in this short school year than we did all semester the fall of last year. So I think we're above 350. I won't give you the exact number of classes or cohorts or groups of young people who've been excluded from school. That's a significant item because I think that in the health district alone, I think there are approximately 160 or 170 schools. So we have a lot of school-related exposure and a lot of risk at schools for contracting and being exposed to COVID-19. So in a long-winded way of saying, yes, we're pleased that the number of cases in schools and the number of outbreaks in schools is going down, but also to consider that in context of the overall burden of illness in this academic year.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Last week it was announced that the province is going to be providing a supply of take-home PCR tests to schools starting in a couple of weeks. I'm wondering, what was your reaction to that news? Do you think it would be helpful? And do you have any details on what that rollout looks like here locally?
Well, go ahead.
I was just going to say that, we haven't really reviewed that, that announcement in the context, in our context here in Windsor-Essex, and it does require some discussion and review with our school boards and within our local context under the guidance of our medical officer of health. So, be difficult for us to sort of comment on the operationalization of that announcement, given, it came out, late at the end of the week, but I'm sure Dr. Necessary will have something to add.
As doctors and as public health officials, we like to keep every option available to us at the health district to try to manage COVID-19 and in the correct set of circumstances, there may be a role for testing. At this point, we continue to evaluate the situation, and there are generally very limited circumstances where one would test a group of asymptomatic people. We don't really know the context just yet of the testing guidance and testing recommendations. And we would only offer testing when we think that the risk versus the benefit supports the testing program. This is not unlike other screening and testing programs that we do in the public health service. And we just have to be judicious about how we employ a program of that nature. Secondly, we have to work with the school board, and we continue to work with the school board on a regular basis to formulate plans to keep the schools safe. The real goal is not testing, but the real goal is to try to keep schools open for instruction. And that requires a suite of measures, which is already being enacted, which is screening at the door, social distancing, making sure that people that are sick do not attend school, when people are eligible to get them vaccinated. Those are the suite of interventions I think are probably most important at this level of the pandemic.
Thanks very much.
Any questions from Blackburn?
Yes, as you know, the Americans are going to start letting in Canadian travelers in 1 week from today. Now, I wanted to ask you, I know earlier in the pandemic, Windsor-Essex County Health Unit was monitoring cases in Michigan and in Detroit specifically. Do you have any concerns about the rates over there and Canadians going over there and then coming back?
Well, we always monitor the situation locally on province of Ontario and worldwide, and we'll continue to monitor that as part of public health practice. Clearly, areas that are on the border have to consider the effect of border travel and border people living in Canada and traveling to the States and the other way around. So we always look at those pieces of data to make judgments about what is the best public health plan for the district. And I'm hopeful that the number of cases will remain under control. And if there's a change in the burden of illness, then we'll have to reformulate our public health plan to address that issue.
Do you plan to make any changes to what you're doing now when the border does reopen?
Well, we always keep every option open and available to us. I think what we're doing currently is to monitor the situation. And I know the federal and provincial authorities are also looking into this and monitoring the situation. And then we'll make decisions based on the data that's available at that point in time.
Okay. And the last question was these tests that the province plans to set home. You mentioned that you haven't really looked at the legislation. That's fine. But the concern you had in the past with the rapid antigen tests was that they aren't as accurate as the PCR tests. Now they're sending home the PCR test. Does that alleviate some of your concerns that you had about at-home testing?
Well, screening, testing is actually a complicated clinical issue. If I could just digress to a highly technical response, the better the sensitivity and specificity, the better the test is overall. But whenever you do testing of people, you have to consider what the background risk or what's the likelihood that the person might test positive based on the burden of disease in the community. If the background risk is low, then your test may identify more people as false positives than true positives. That is one of the concerns about screening. Testing an individual person who is sick in your office or in your clinic is primarily there to benefit that particular individual. When you're testing a population or a community of people, you have to consider what the consequences of a true positive and a false positive are, and how you're going to manage both of those. So I know it's a long-winded and sort of a meandering answer, but I think we have to work on the facts and circumstances of when the test will be used and how it will be used. And I'm reluctant to order testing on people, on a community of people, unless we think that there's a public health benefit. That's distinct, I know, and this is a challenge. That's distinct from how lay people might understand testing overall. And just to summarize, we obviously will consider every possible option at the Public Health Service to manage COVID-19. And when testing does have a role, and does have a role in certain limited circumstances, we definitely will include that in the public health management plan.
To clarify, you're still concerned about the accuracy of the PCR tests at home?
Yeah, that's not, I think, my point. I think that the testing for large groups of people has to be done with some level of circumspection. The PCR test has a better characteristic. Overall, the PCR test is better than the rapid antigen testing. So I think that it's better on an individual level. But the question at hand is, should you test large groups of people who are asymptomatic? And the answer to that is only under very limited circumstances, even with the PCR test.
Thank you.
Sorry for that long-winded answer. It is a complicated, I wish I could give you a straightforward yes or no answer, but it is complicated for sure.
I appreciate that, and don't worry about it. That's good. Thank you.
Okay, you're welcome.
Any questions from Windsor Star?
Yes, good morning, Nicole. Good morning, Doctor. Perhaps this is more a question for you, Nicole. Looking at the Health Unit's website, why combine community and workplace outbreaks now under the same list and no longer identify the locations by name with community outbreaks as you had been doing throughout the rest of the pandemic up until now?
Yeah, thanks for the question. And we'll probably have a more updated, I'll give a little bit more of an update on some change. We're just making some changes to our local data page to be a little bit more consistent. And some of the things we're looking at is exactly as you're seeing, is identifying, all of our outbreaks and then trying to be more consistent in the way that we name them. So, by sector, as well as we'll be looking towards an effort to having all outbreaks, at least going forward, listed consistently on our website, and then we'll look to go back as well. And so it's quite a bit of workload. Part of this is in conjunction with our public exposure notification. So we do the public exposure notification. So where there is an actual risk to the public, or it's important either legislatively, we have to name a business, we're doing so. But where there's not legislation, we really, will be only sort of naming those institutions or businesses or events if necessary, and that would be under the public exposure notification. So that's where there is a risk to the public, and it's important to notify the public and identify specifically the location. So we're just making it consistent between what is identified as quote unquote a community outbreak, and basically community is just anything not defined, defined within our guidance. So it's not a workplace as defined in the guidance we get from the ministry. It's not a long-term care retirement home as defined. And then we have specific guidance and rules around daycares and schools. And so everything else falls to community. And so we're just making it consistency in the way we're reporting between all of the various sectors that don't have a specific legislative requirement for disclosure.
Okay, thank you.
Any additional questions from AM 800?
Sorry, Nicole, just going off that. So for example, I'm looking at the website right now, and it says fitness and recreation, LaSalle, Delta variant, yes. So would that be considered, because I know last week there was the outbreak at the Vollmer Center, then it was lifted later that day. So would that be, for example, where it says fitness and recreation, would that be kind of considered like the Vollmer Center, or the Vollmer Center would be under the public possible notification point?
Yeah, so what we'd be doing, Rob, so it's a good exact example. So fitness and recreation could include a team. So where we might have an outbreak in a league, for example, or it could include, or it could be, like a recreation facility. Those are also workplaces, so it's challenging. Sometimes they'll fall under, we'll have workplace fitness recreation, and then we may have fitness recreation or sport, which could be a league in some cases. And then again, where there's a public exposure or need to inform the public, we will have that information under the public exposure notification. So if that makes it more clear or less clear.
Okay, thank you. Doctor, one final one for you. In one of your previous comments, you talked about the number of eligible residents that can still get the vaccine. I believe it was earlier this month or late last month, it was around 60,000. Do we have an updated number on the number of eligible people that can still get vaccinated in Windsor-Essex?
We can try to get you an estimate of that. We can ask the epidemiology team for that. Do you think you could just send us an email to that effect so we can get that assigned?
Sure, thank you.
Okay.
Any additional questions from CTV?
No, thank you.
Any follow-up questions from CBC?
No, thank you.
Any questions from Blackburn?
I'm good, thank you.
And finally, any additional questions from Windsor Star?
No, thank you.
All right, thank you all very much. Have a great Monday, and we will see you again on Wednesday morning.
All the best.
Thank you. Bye-bye.
Bye-bye.
Thank you.